In this video, we're going to continue on with major depressive disorder. By the end, you should be able to explain how antidepressants work, or at least how we think they work, be able to recognize what are some atypical antidepressants, and then discuss alternative treatments for depression. So the question of the day is, how do antidepressants work? Now take a look at that table that you made while watching the previous two videos on monoamine oxidase inhibitors and reuptake inhibitors, and look and see what do they all seem to have in common. What neurotransmitter do they all seem to have at least some effect on? Serotonin. And what are they doing to those levels of serotonin? They're increasing those levels of serotonin. So low levels of serotonin are suspected. However, this hasn't been confirmed. They've looked at serotonin levels in the blood, seems to be lower in people with depression. They've looked at different things, serotonin receptors in the brain. It doesn't give us an accurate picture. So the idea is we really still don't know. And there's actually a very puzzling problem with antidepressant drugs, is that those drugs, those tricyclics, those SSRIs, SNRIs, monoamine oxidase inhibitors, they're going in, when someone ingests them, they go into the brain and they take effect within minutes to hours in terms of altering those levels of those neurotransmitters. However, people typically need 2 or more weeks to experiencing any type of mood elevation. So it's not like someone takes an antidepressant and instantly feels better. They need time. And so the question is if the neurochemistry in the brain is being altered almost immediately, why is there this lag time in the change of symptomology? One proposed idea is that something called BDNF may be involved. So BDNF stands for brain-derived neurotrophic factor. So again, that's brain-derived neurotrophic factor. And this might be important because we know that BDNF is involved in the production of new neurons, so that neurogenesis, and involved in the production of new synapses, so plasticity of the brain. So that perhaps in order to alleviate those depressive symptoms, the brain has to have some sort of reorganization, and you need BDNF in order to do that, so that these drugs are really not affecting the levels of the neurotransmitters, but it's that increase in BDNF that's important. And when we talk about some of the other alternative treatments, perhaps that's why they're just as effective sometimes as antidepressants. So the next question is, how effective are antidepressants? So unfortunately, their effectiveness is limited. So not everybody responds to them. Not everybody sees their symptoms improve. And even sometimes without treatment, people will recover within a few months. Depression seems to have cycles, and so even without medication, people seem to come out of that depressive state at some point. And here's kind of the big thing, is that many people with depression respond well to what are called placebos, which is nothing more than a sugar pill. So I'm going to let you watch a 60 minutes clip that talks about this. It might be a little on the older side, but it's still that same argument going on where people criticize big pharmaceutical companies for not putting all their data out there. So now we're going to talk about atypical antidepressants. And these basically are drugs that aren't those drugs we talked about on the previous two videos that affect those monoamines. So they're a miscellaneous group of drugs that seem to have antidepressant effects with mild side effects. And we're not going to be able to discuss all of them. But one that I wanted to present to you is ketamine. So ketamine infusions is on the rise in terms of a treatment for depression. And think about, you might be like, well, I've heard of ketamine before. And if you think you've heard of it before, well, one, it is a horse tranquilizer. That's a lot of times what people think of immediately. It's a tranquilizer. It is a dissociative hallucinogen. And so basically what that means is when someone has, or an animal or a person has large amounts of ketamine, they feel dissociated from their body, and so that's how it acts as an anesthetic. And it was used for a number of years in humans, but people, when they come out of the anesthetic, they have some odd symptoms. And so it is still used in animals. When I worked at both my labs, actually, ketamine was the drug of choice for anesthetizing our animals. And it was very heavily controlled because you also might be thinking, I didn't know it was a horse tranquilizer, but I've heard of it as a club drug. So Special K is another name for ketamine. I'm sure there's other names out there. However, besides those two things, kind of just in trying ketamine out for treatment for something else, they noticed that it seemed to make people a bit happier. It seemed to elevate their moods. And so with these ketamine infusions, there's really a rapid onset in terms of alleviating depressive symptoms. And so there are ketamine infusion centers out there where you go in and a small dose of ketamine is administered for about, I think it's about a 40-minute drip. And then before you're allowed to leave any type of effects, but really the dose is so low they say it doesn't really cause hallucinations that I've heard of. And what ketamine is targeting, what the neurotransmitter is completely different than those other antidepressants. It targets glutamate, so it alters levels of glutamate. Now, ketamine, of course, is very controversial because of its hallucinogenic effects, being used as a horse tranquilizer. And then also, maybe you thought there's one other one. It's also been known to be used as a date rape drug. And so with those kind of connotations, it has a bad rap. So what has been approved for use is called esketamine. And I have another video that you're going to watch that will discuss esketamine as well. And it has been FDA approved to treat depression, and it's a nasal spray. And so ketamine basically has, what I understand, is two isomers, and esketamine is one of them. And so the idea is that this esketamine should not have that same hallucinogenic effect, but can still alleviate some of those depressive symptoms. St. John's wort is another one. It's an herb. You can get it over the counter, and it's marketed as a nutritional supplement, so it's not really regulated by the FDA. And it can, the problem is that it can decrease the effectiveness of other medications. So if you're taking other drugs for other medical purposes, you have to be careful when you take St. John's wort. Because basically it increases the activity of a liver enzyme, and so that breaks down those other drugs more quickly. And now just to quickly discuss some alternatives to antidepressants. For some of these, you're going to watch some video clips on them. So psychotherapy is an alternative to medication. A lot of times, psychologists or psychiatrists will use the two in conjunction because it's not enough really to just take a drug to fix that neurochemistry. You have to figure out what's the underlying purpose of this depressive state. Psychotherapy tends to be longer lasting. And again, it might have to do with a reorganization of the brain, that as you're going through those therapy sessions, you're learning to think differently. You're learning to process things differently. And so you have, again, plasticity of the brain and perhaps BDNF being involved. Drugs and therapy tend to have a synergistic effect, which means it's not just, it's just not like, okay, let's say the drug works to a level 10 and therapy works to another level 10, and so together you have, it combines the effect, so now you have a 20. So now we're going to talk quickly about some alternatives to antidepressants. So psychotherapy is considered an alternative to medication, and really it has longer lasting effects. And this might be because not only you're learning to think differently, you're learning to process things differently, you're having, your cognitions are being changed, and so as that's happening, you're also having changes in your brain. And so that plasticity, that BDNF, brain-derived neurotrophic factor, may play a role in that. What we also see, and this is what a lot of therapists will do, is prescribe drugs, but also therapy at the same time. And what we see is what's called a synergistic effect. So this means that, let's say, drugs improve your symptoms to 3 degrees, and therapy by itself will improve your symptoms 3 degrees. Now together you'd think that would give us 6 degrees of improvement, but it's not. It's more than the sum of their parts. So synergistic means that each has an effect alone, but together it's more than the sum of their parts, and so making it much more effective. Electroconvulsive shock therapy is another treatment. It's basically an electrically induced seizure. And so as you see here is that they're putting the electrodes on the side of the brain. They have something in the mouth so that the person does not bite their tongue. And basically, it's for patients that haven't responded to antidepressant medications or suicidal. It can be applied every other day for a period of 2 weeks, but there's side effects. So memory loss is one of them. I actually have a friend whose sister has undergone ECT for her. Hers is bipolar disorder, but it's only used in very severe cases. Now, she's not only does she have bipolar disorder, she's a recovering alcoholic, actually now a recovering addict. And she's just had so many issues that they finally resorted to this. And my friend said that she does have some memory loss right around like when it happens, but it's not life-threatening type of memory loss or anything. And basically what it's doing is this electrically induced seizure ends up increasing new neurons in the hippocampus. So again, here's that theme of plasticity, probably brain-derived neurotrophic factor again, but a changing in the way that the brain's reorganized. Transcranial magnetic stimulation, now repetitive transcranial magnetic stimulation, is a safer alternative to ECT. It does a similar type of thing, but it's not as severe, and that's what this diagram is showing you here. You'll watch a video on fMRI neurofeedback, which is a newer way of basically trying to get the person to change their brain activity on their own. So again, here with all of these, we're talking about reorganization of the brain, plasticity of the brain, and again, most likely brain-derived neurotrophic factor. Regular, non-strenuous exercise is also recommended. It increases blood flow to the brain, potentially increasing BDNF. When I was at USC, one of our collaborators had a little treadmill for rats, and a lot of research was going on at the time showing that exercise increased brain-derived neurotrophic factor, which we knew was involved in plasticity. And so, again, seems to be a common theme there.